Well, there's been enormous developments in the field of cancer, particularly with regard to lung cancer, so that we're seeing for many patients, survival has been significantly improved. And that's the good news. The other side of that coin is there's many more people living with lung cancer, living with advanced disease, and actually many more people dying of lung cancer, partly due to demographic changes in the population. And there's been enormous investment in the medical treatment, in biomedical research in cancer, but there really hasn't been a parallel investment in research and clinical care in the human dimensions of cancer care, in the psychological, social, and cultural dimensions. And that's an interesting question in itself as to why we see that imbalance. Some of it is about value systems, that there's a tendency in medicine to value the physical and the biological more than the psychological and social. Some has to do with commercial drivers, that there's commercial and other incentives that drive pharmacological and other technological developments that don't drive attention to the psychological and social. So actually, we've launched a Lancet Oncology Commission on the humanitarian crisis in order to understand this imbalance in lung cancer and in all cancer and the rest of medicine. What are the drivers of this balance? And how can we rectify this imbalance? So that's a sort of broad overview of it. We hope that this approach and this way of thinking will lead to as much attention to the quality of life, the psychological well-being of patients with cancer and their families, as to the disease itself and to this progress and of the condition and survival of the patients.